So we're going to do this a little bit more casual style without a presentation. This is not us just pushing information out to you. So we're going to do it in a little bit more of a conversational way. And as you go along, if it sparks more questions for you that we didn't cover, you can either save it and ask it yourself when we get to the Q&A, or you can throw it in chat anytime.
Excellent. Great.
All right, so you have the questions, Kelsey?
I do, yes. So
all right, fire away.
All right, thanks, Candace. So there does seem to be quite a bit of confusion around the deadlines for panel submissions. And so we're just looking for some more clarification. What deadlines are there and who do they apply to?
Yeah, that is the question of, well, for the last couple of weeks for sure. So if your physician is on the LFP payment model, the deadline to submit the patient panel is October 31st, which is only 11 or 12 days away. So if you work for a physician on LFP and they haven't yet uploaded their patient panel, please let us know and we can help you get that done by October 31st. If your physician is on fee-for-service still, and then their requirement is to upload the patient panel on the provincial attachment system mechanism December 31st. So that's their deadline. So LFP is October 31st, fee-for-service is December 31st. This new fee-for-service requirement just came out. And so while we were telling fee-for-service docs, you don't have to worry about cleaning up your panel, they now have to. So if you need some support cleaning up your panels, please let us know. We will be sharing some links for resources around that tonight as well. And so the deadline for LFP, October 31st, I'm hoping the majority of those physicians have done that already. And you're welcome to put in chat, like, we haven't, and we'll contact you if you want. So if you're one of those offices that haven't submitted your panel and you still need to, you can just let us know in the chat and we can reach out to you to make sure you get the support you need in order to do it.
Absolutely. And I do have actually, I'll send that link in a moment here. So that's excellent, great to know. And so how accurate do the patient panels need to be? Do they need to be exact?
Yeah, good question too. I think that people are really, in some cases, getting worried about, having to go through and micromanage every single patient that's on the list. You don't have to do that. If you do a first pass at cleaning them up, and so by that I mean if patients haven't been in 5, 6, 7, 8 years, mark them inactive. And if you know that they've passed away or deceased or transferred somewhere else, mark them inactive. But you really don't need to spend a lot of time on it. You really don't, because in both cases, there is no payment calculation based on the panel that you submit. So when you submit your panel, if it has a patient name on there and that person's moved to Alberta or hasn't been in a couple of years, you don't need to worry about it. The doctor is going to get a payment that's already being calculated by a different calculator, which is the same one that they use for the CLFP payment, which is called MSOC, which is majority source of care. So don't worry about going through your list of 1,200 patients or how many ever you have on the doctor's list and looking at them individually and worrying too much about the accuracy. You don't need to do that. Just get it pretty good.
Excellent. And I'm going to share a resource in the chat here. So this is a link on the instructions on how to actually submit the panel to Dr. Bill. So just put that through there. And so it's pretty easy to do. So it's very well done instructions. And once you've got your panel, it's very quick to upload it. So it's very straightforward. I've also got a link here that I'm going to share for a formatting cheat sheet. So when you do pull your list, you may have to do a little bit of formatting, and that's very easy to do as well. There's a cheat sheet that I just shared, and so it'll just show you how to manipulate the first and last name if it comes in the wrong order or if it comes together. It'll show you how to separate it, and then all you have to make sure is you have a column for a first name, a column for the last name, column for the date of birth, and a column for the PHN. And then it'll be formatted and you're good to go.
So a couple of notes. Now that it's past October 13th, you can't submit your list through your EMR. It has to be through Dr. Bill. So you've passed, if you're on a Curo profile, MedAccess, you could have done it through your EMR, but not after October 13th. So now everybody needs to use Dr. Bill. So we've got the cheat sheet in here as well. And I see a question in chat from Nikki. It says you're on CHR and they've gone through and cleaned up all your panels, which is fantastic. And it says that they've submitted it for you. This part I'm not sure about, because when you log into Dr. Bill, you have to have a Dr. Bill account, and it's per physician. And so you open it up and you fill in the physician's information, MSP number, facility number, email address. Then the email you get sent a verification code, and you need that verification code in order to go through and finalize opening up the account. So I would check with CHR what they mean by submitting it for you. Like, did they create a Dr. Bill account for each physician, or do they have some other way that they're able to send your lists not through Dr. Bill? So Nikki, I would clarify that with CHR and just ask those questions. Because you probably, I don't know how many physicians you've got, but it has to be one account per physician. Yeah, so double check on that. And it sounds a little, I don't know, because Kelsey and I have gone through the process of uploading to Dr. Bill from different EMRs, and the Dr. Bill part is all the same. And you've only got one doctor under LFP, so that makes it easier. Do we need to register for the PAS? We are on LFP panel and already submitted. So this is a really good question as well. The provincial attachment system is being rolled out, and if you are on LFP, you don't have to submit your panel because you've already done it. So your patient list will already be there. It'll already be accessible for the attachment system. If you are on LFP, you'll be doing it by December 31st, so your panels will be uploaded as well. That is different than registering for the PAS. So on the provincial attachment system, every clinic will be registered by the medical director or somebody designated at the clinic to register the clinic and put a bunch of information in there about your clinic type and if you've got physicians accepting patients and who the physicians are in your clinic. So that is actually attached to a $2,000 payment for the medical director. And then every physician individually will need to register, well, not need to, can register for the provincial attachment system by going through their BC Services app and doing a bunch of things. And Mary Lou is a little more versed in that because she's helped a couple of physicians already. So what we saw in a communication today was that we don't have to worry about physicians registering just yet. They haven't put a deadline, or it might be December 31st. However, a communication that we saw today went out to physicians, and it states that all clinics need to be registered by October 31st. So we're going to send out a communication after we clarify some things tomorrow. We're going to send a communication out to all of our physician members to let them know what we learn about that and whether that's a hard requirement or not. So good question. It is not mandatory to sign on to the provincial attachment system. However, it kind of is because payments are attached to it. So one payment is the LFP panel. Another payment is the CLFP payment for fee-for-service doctors. So if you're a fee-for-service doc and you don't sign up to the panel, and you don't send your panel in, you don't register, you're not going to get the CLFP payment. And two is that there's $2,000 for the medical director to register the clinic, and there's $6,500 per physician when they register. And they won't qualify for either of those if you don't register. So the only one that has been stated so far is the deadline of clinics being registered, and that's for the medical director, and it's $2,000 by October 31st. And like I said, we're going to clarify some of that information tomorrow. And so if we learn anything that's different than that, or any other deadlines for physicians, we will share that out with everybody after that.
Great.
I'll be happy to bring the question from Kate about the physician that's on medical leave. I will bring it up into my meeting tomorrow morning.
Oh, great. Thank you. Another question is, how often do we do the submission? Right now, it's just a one-time thing. They've stated that it would be an annual thing. I don't know when the second go-round or when the annual one will be. It might be an anniversary date of October 31st each year, or they might shift it to something else. Mary Lou?
Yeah, what I read today in one of their communications, and this is coming out every day, right? So this is the latest update, is that they are getting the payment, the $6,500 payment, I believe, for the physicians doing the submission on the PAS, for them to send their panel and to maintain it. So that's also something that I need to understand, because they were talking at this webinar about them having to send all the information and then keep it updated. If you know that your patient moved to Victoria or moved somewhere else, then you have to update it. So it's not quite clear, and they did say that they will be adjusting the system. So there's not a lot of clarity at this point, but it does require keeping it updated.
Yeah, and we want to have some influence and some pushback against having to micromanage it. Like if you go into your EMR and you learn that a patient has moved and you change the status, then you have to go into the attachment system and do that. Or can we do it every 3 months or once a year or whatnot? So we'll learn more about that and what that actually entails. For the $6,500, I doubt that it's just register and call it a day. There's probably ongoing work that is supposed to cover. Yeah. So we have a list of questions that Mary Lou will pose tomorrow to in the webinar. So that'll be good to get some clarification. But we will share that with you. Thank you, Mary Lou.
Yes, thanks so much. All right, so then, yeah, so what are some of the common questions you get around the LFP billing model, would you say? Some, like, I'm trying to think of some of the common questions I've received as well, like, for the LFP. I mean, I think actually what you just said was a good touching base on, like, okay, for the next round, the next payments, like, how is that going to work? So, yeah, no, it's
yeah. So one of the questions is about how they're going to come up with the panel payment. So we know, I think we've got nailed now the time codes and the interaction codes, but what is this panel payment and how are they going to calculate it? So right now they're using a combination of MSOC and something else I can't remember, but in the future, in this next coming year, I believe, they intend to come up with a better calculator that better reflects the complexity and number of patients that you have. So MSOC is not a great calculator. It's in a nutshell, it kind of calculates how many patient visits did that patient have and who had the majority of those visits. So I, as an example, have seen my family physician twice this year, but I also go get allergy shots once a month. And if they bill that allergy shot through MSP, it's going to look like I have 12 visits with this person and 2 visits with this person. So I would be on the list as a patient attached to the 12 visit person. But it is only strictly for these allergy shots because I have to go to a certain place to get them. The physicians in the office aren't allowed to give them. So there's so many holes I could poke through that calculator. However, they are well aware of that. And there's been a communication to physicians that they're going to get the panel payments. It's quarterly, but they are going to make an adjustment to it because they recognize that it's not fulsome. So going forward, they will build a new calculator that should better reflect complexity and volume. So another question I get is about coding. And so as we all know in fee for service, you could bill a visit with whatever diagnostic code you wanted, and it didn't really even matter. The only ones that mattered were certain things like a PAP has to have a cervical code, a diabetes incentive has to have 250 as a code, but most other visits, you put whatever code you want. And there's no incentive to put more than one code. Didn't matter. MSP doesn't care. Nobody else cared. So the doctors were used to billing their code, their service code, and then just whatever diagnostic code was top of mind. So we all know that patients come in for more than one reason. Our physicians cover a number of topics. They still were only putting one code. In LFP, it absolutely matters if they put more than one code. So complexity means patients coming in didn't just come in for strep throat. They came in for diabetes and hypertension management, and also rib pain. And so what we want to do in the new LFP system is use as many codes as are applicable to that visit. Most of our EMRs are at, you can put a maximum of 3 diagnostic codes. The other thing around billing diagnostic codes is you want to have as many digits as possible. So people like me have been going around forever to the clinics saying, use consistent coding. That way we can pull lists, no problem. So everyone with diabetes is 250, then I can pull a list and say, who has 250 but hasn't been in for a visit or whatnot. So we'll call them in so that we can do the visit and then bill the incentive fee. Those incentive fees no longer matter in LFP, but what they've done is replace it with the complexity panel payment. So let's say a patient had diabetes with onset something. Instead of using 250, we use 250.72 or 250.1. And so the more decimals that you use, the more specific the condition, the more it shows complexity. So use as many diagnostic codes as you can for whatever the visit was, and use the decimals to the most detailed as you can. The better you do that, the better the panel payment is going to be. If you just put one code for everyone all year, they don't look really complex. So that's a big shift that a lot of physicians have to get used to because they've been on fee for service for decades and never had to worry about that kind of thing. Another question that we frequently get is, what about physicians who see a lot of walk-in or work in multiple locations? You have to have at least 250 patients attached to you at each location if you're a multi-location. And if you do that, you can register for both places and you can do LFP and combine. And so you send in both the panels and you're good to go. The walk-in capacity is no more than 30%. So if you see a lot of patients that you have attached to you, but you also work in walk-in, or you're at a walk-in clinic that, you have your own patients, but you're also seeing walk-in patients, that walk-in component of patients that are not attached to you as a physician cannot be more than 30% of the whole year total. So that's a pretty hard one to track. So they're being loose about it this year because nobody has a way of actually tracking that. So this year, they won't be super hardcore about that 30%, but next year they will. So hopefully they will come up with a way to help track that. Yeah. And then the other thing that I get asked a lot is time tracking. Physicians are very nervous about, we submit those time codes, but is somebody going to do an audit of some kind? Does it need to be tracked in some sort of app or something like that, or written somewhere? Or do we put it in the EMR and the schedule work from here to here? And did indirect care from here? Like, would they, some physicians are kind of thinking, I'll block the time like an appointment in the calendar to go indirect, and that way it shows the direct and the indirect. And so they're really worried about that. We have gotten no direction or instructions on how to track time. And but we have shared out. There's an app called, is it Toggle?
Yes. Let me
And
get
what that does, and
Yeah.
that what does is it's like a start stop. It's like a timer, start stop, start stop. And so I'm doing direct, and I hit stop because now I'm doing indirect, and then I start that, and then I'm doing indirect again, stop, start. And so it tracks your day. It also holds that record of your time tracking, and it builds up so you can look back at last year or last month or whatever. So there are some apps out there that are time trackers. We did present on that at a physician meeting, so they are all aware of it. However, that was also back at the beginning when there was information overload. So we could circle back and share that with everybody if you'd like. Yeah. So those are pretty, oh, thank you. Kelsey put the Toggle app in the chat feature. Okay.
And it's very easy to use.
Yeah, so I think I just want to go back to that question for Annabelle. Do you need to register for the PAS? We are on LFP. So yes, you will register for the PAS, but you've already submitted your panel. So you don't need to submit a panel again, the list of patients. You won't need to do that again, but your physician will need to register with the provincial attachment system, but we don't know what the deadline is for that yet. And they haven't even put out instructions on how that payment, the 2,000 and the 6,500, are going to be paid out yet. So it says instructions coming in the following weeks. But when we get clearer guidance on that, we will send that out to the MOA network.
And then I think we've recently found some good resources for clinics that are online. Should we take a look and possibly show them or bring them up here on the screen? I
Yeah.
can definitely share the links here in our chat.
I've got them all open already if you will allow me to share screen.
For
And
sure.
so just to be clear, well, because all of this is unclear, it's clear as mud, really. The thing that we saw in communication today was directly speaking to medical directors to register clinics, October 31st. They haven't said specifically around each individual physician and when they need to do it by. So that's one of the things we need to clarify. I just wanted to mention that. So if you have a medical director of your clinic and they haven't registered yet, get them to register by October 31st. So let's make sure that they do that so that we don't miss that deadline.
I just posted in the chat as well the link to the recent provincial attachment system update, and then as well the resource for the links for the steps for the director for the provincial attachment system.
Great, thank you. Okay, share my screen.
Oh, did it give you permission? Okay, great.
There we go. So can everyone see that? And let me know, I've got a bunch of windows open, so I'm going to switch from one to the other. So if I have to stop share and share again, let me know. So right now, I'm just putting the new requirements up for the CLFP payment. So this is specifically for fee-for-service doctors. If your doctor's still on fee-for-service, you want them to get that CLFP payment, which means they need to upload their panel to the provincial system by December 31st. Again, I don't have the instructions for uploading the panel to the PAS yet. That's in the coming weeks. So we will share the instructions out with you once we get it. So don't worry about that until we send you the information around it. Can you see business pathways?
Yes.
Okay, good. Then I don't have to stop share again. So under the Doctors of BC website, there's a lot of stuff, some really good stuff for MOAs and for physicians. So under business pathways, so when you just go to the regular website, you don't have to have a login. It has a little menu down the side. When you go to business pathways, There's a little video on it, but here's the resources to explore. Starting your practice, opening up a business, managing your office. What do you do when you have to close your practice or your solo physician retires? There's a business corner with a whole bunch of interesting links I just looked at and some virtual events. And I wanted to highlight a couple of things here. There's a human resources toolkit. Do I have it on here? No. Oops. Mouse is stuck. There we go. So human resources toolkit, which I didn't know was here. I was busy. We've been at the division. We stole someone else, another division's toolkit, and we've been modifying it to make it North Shore applicable and things like that. But there's actually a whole bunch of stuff in here. So under each of these squares is a set of tools. So I strongly encourage you to play around in there. So under, as an example, under hiring, it's got posting job descriptions, how to interview. When you go under interviewing stuff, it's got some sample questions that you can ask during interviews, all sorts of things. Onboarding, how to onboard, and setting performance and development skills. So conducting annual reviews. I find that a lot of our clinics are lacking this whole process for an annual review. How are we doing? What are the goals for the next coming year? And what are the things we need to improve on or worked on in order to potentially get the raise that we are hoping for? So we will be bringing this to the physicians because we need to get them on board with having a more robust system for hiring and maintaining these processes with staff, so that staff is happy, and we're going to bring it up with the physicians in a retention way. We don't want a lot of staff turnover at clinics. We want MOAs to be happy and stay, and so part of that is a proper process of understanding what employment is, what the job role, what the role entails, but also annual reviews and being able to understand what you need to do in order to get that raise, and setting some goals and providing some development, some skills. So yeah, that's an example of the business pathways. And there's another one under here that's contingency planning. What if your office has a flood? What if something happens? What is your contingency plan? There's also WorkSafe and ICBC information. Yeah, but under the business corner, I found a couple of these really interesting. So recorded webinar on the changes to the re-referral process, maximizing your billing. But there was a section under here. So there's employment law. I think all physicians should be looking at that. But there's an MSP billing learning opportunities for medical billing staff. So if you're still on fee-for-service, there are two things under this. One is an MSP tutor, and then one is a medical office assistant billing guide. I wish I'd known about those if they, if they're a thing. I wish I'd known about them a lot sooner. I would have shared those, but I just found them yesterday. So we keep looking at these resources to see what's being added, what's being updated, and whatnot. So anyway, business pathways, we wanted to highlight that. So there's a bunch of stuff under there and a little video. But take a look at Doctors of BC, and under managing your practice, there's just a ton of stuff. There's also Doctors Technology Office. So under here, if I go to Health Technology Resources as an example, you'll find EMR resources for panel cleanup. And this is how to clean up your panel. We're going to be obviously cleaning up our panel on an ongoing basis. So these will be relevant, every time you have to do some data cleanup for your patient panel. So there's a bunch of stuff under there, some how-to videos and some cheat sheets and things like that. But there are other resources, like if you're doing a data migration, how to prepare for it, and a conversion checklist. So I would explore under Doctors Technology Office as well. There's a bunch of things under doctors we see that really like compensation, that's really a physician thing. Billing and audits are a physician thing, but business pathways and doctor's technology office has a lot of relatable MOA resources and training materials. That's one of the ones I wanted to show. And then Kelsey already gave the, how to submit to Dr. Bill. So it's a nice, easy cheat sheet. So the link is in the chat. And then separating columns. This I never even knew how to do. So I know some EMRs in particular, it comes out in this format where it's last name, comma, first name, but we need it to be in 2 different columns. So it's a very easy process, which winds up with your columns separated. Didn't even know you could do that. I probably would have done it manually. And I think I've done that manually.
Oh,
I have done everything manually before someone shows me, hey, there's a way easier way to do that.
I'm definitely not an Excel wizard by any means, but I found this instruction extremely easy to follow. I was very proud of myself when I was finished.
Excellent. So those 2 things. And then for registering the clinic, this is for medical directors, registering to the clinic for provincial attachment. It's got a little step-by-step guide. You go to this website, you add the clinic. If there's an issue, contact the PAS through Zoom. Confirm the clinic details, add the members who are the physicians there, assign a manager, and update panel preferences. So what's really interesting is a lot of clinics are finding that their clinic is already on the system. I'm not sure how it got there, who put it there, or whatnot, but there are actually a bunch there. Mary Lou?
Yeah, they did a survey apparently a couple of years ago, and I forgot what it's called, what the survey was called, but they added all the clinics back then and validated all that. So we didn't know it was going to be used for this, but they did the survey and that's how they are there. And almost everything can be modified once you log in. The only thing that can't be modified directly on that website or on that tool is the name of the clinic. So if there has been a name change and you are clinic X and it says clinic Y, then contact me directly and I will give you the steps. It's an email that has to go out. I don't want to overload you with more links, but and there's not many more in that situation. I think I've contacted them, but yeah, it's super easy to update for your directors. And if anybody has any trouble going through the PAS, please have them contact me. It doesn't take long. I just wanted to mention a situation that we went through today with Kelsey, and it was a doctor that didn't have Excel in their computer at the office. So we used Google Sheets. They will require a Google login or a Google, what is it called?
a Gmail account.
Yeah, but it's a Google it's a Google account, let's say that. So if you have a Gmail, you should definitely have a Google account. So Google Sheets is free, and you can import or you can open the CSV .csv file. So when you're saving from in this case it was Accuro, and now Kelsey and I are experts, you can just import it through Google Sheets and modify the columns, and you don't need to buy Excel or any of that. So that's just like a nice tip to have.
Excellent. But yeah, all of this stuff is easy. It's just the finicky bits of learning how to do it if you've never done, like if you've not worked with spreadsheets before, if you haven't done those specific tasks yet. So when I was looking at that splitting the columns thing, and in particular, wolf clinics have a hard time downloading an Excel spreadsheet to their desktop. So sometimes they have to save it to documents and then copy and paste it to their desktop. So there's little workarounds, but once we know what they are, it's super easy. So we try to share that out with anybody who's going through that. So I think I've shown everything that I wanted to show. Is there anything else, Kelsey, that we were gonna show as a resource?
I think we have covered it all. We've gone over all the links here I've got, and can't think of any other, resources
Okay.
that. Mhm.
I'll stop sharing my screen there. Were there any other questions that we had on our list?
That was it. We've gone over them all. Yeah.
Excellent. Okay. And then I think we've gone through all the questions in chat so far. So let's open it up to the crowd. Maybe we'll stop recording. And let's open it up to the crowd.